All right, everybody, I think we are going to go ahead and get started. Good morning. My name is Camille Zarzar. I'm the manager of events and CE at the North Carolina Nurses Association. Thank you guys for joining us today for the Facts Not Fear Coronavirus Update, our live webinar. We have a packed agenda and a really great lineup of awesome speakers for the presentation. Before we get started, though, I do want to go over a few items. So we'll move on. So our disclosure slide, to receive contact hours, nurses must attend 90% of the CNE activity. An evaluation must be completed at the conclusion of the activity. Neither the speaker nor members of the planning committee have any conflicts of interest related to the content of this activity. The North Carolina Nurses Association is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. The learning outcome for today's webinar is nurses will gain knowledge and increase awareness about the current status of the coronavirus COVID-19 outbreak, preventive actions and impact on the community. So if you have just a few announcements, if you have questions throughout the webinar, please utilize the Q&A feature that you'll find at the bottom of the tab, either at the top or bottom of your screen in the webinar. It says Q&A. So you can submit questions at any time, and we'll have a designated question and answer session at the end. 1.25 contact hours will be offered to NCNA members for the live webinar. An email will be sent out to those members after the webinar concludes for you to be able to obtain your CE certificate. The webinar today will be moderated and led by Lily Chen, a professor in the School of Nursing at North Carolina Central University. We are grateful to Lily and all of our speakers today for their time and the content that they'll provide us. Lily, I'm going to go ahead and pass it over to you.
Thank you so much, Camille, for inviting us to speak, and thank you for NCNA for your great collaboration, Kathy. And also I want to thank a special member, ANA President Dr. Ernest Grant, and also our NCCU Chair, Dr. Yolanda Van Riel. Thanks for your support. It is a great honor to be with you, our colleague nurses, and we are just so excited to share what we know with you, and thank you so much for what you do in the front line. So this slide, I wanted to, you pay attention to the protective gear that these nurses wear. And this is a nurse, the picture was taken in 2003 during the SARS outbreak in Guangzhou, #1 municipal hospital where I used to work. So here it says, let me translate this, and you know, we can achieve the culture competency outcome, right? So this is June 5th, 2003. We finally closed the special unit after 109 days and nights. It is the fight between death and life, and blood and tear. This fight will disappear with time passing. However, the soul of these incredible people will never disappear. And by Xiulan Feng, Miss Feng is a dear friend of mine that I used to work with and study. And the reason I wanted to show you this slide is that she was the one that provided incredible leadership and used nursing science to develop a very strict isolation protocol and making sure that it's strictly followed during the SARS epidemic. So they accepted the sickest patient in the entire city right now. Is about 20 million people in Guangzhou. And during the 3.5 months time, taking care of the sickest patient, there's none healthcare workers infected. This is a very encouraging news that how nurses can be empowered if we use our creativity, leadership, and also most important in science to just making sure that we all follow that, and then we can make a positive outcome. So with that said, I wanted to introduce our distinguished panels of speakers today, and thank you all for participating. The first speaker is Dr. Bao-Ping Zhu, is an MD, PhD, and also MS. Dr. Zhu currently serves as the Director of a Quality Performance Management Research Program and National Association of chronic disease directors. He has more than 30 years in public health experience working for CDC, state health departments, WHO, and in foreign countries. He also served as CDC Epidemic Intelligence Service, EIS officer. And Dr. Paul Lee is our second speaker. Dr. Paul Lee is the founder of Calvin J. Lee Memorial Foundation and a board member of United Chinese American UCA that I'm proudly part of as well. He had a bachelor's degree in biology from Wuhan University and PhD from Cornell University, and conducted virology research for 7 years at the Chinese Academy of Science and Cornell University. Our third speaker is Dr. Justin Chen. Dr. Chen is the medical director at Massachusetts General Hospital, executive director, MGH Center for Cross-Cultural Student Emotional Wellness, and assistant professor and co-director of medical student education in psychiatry at Harvard Medical School. Our last speaker is Dr. Helen Shih. Dr. Shih is a holistic health consultant and former associate professor at MD Anderson Cancer Center. She has a large family in Wuhan. So does Paul. And she has previously worked in developing infrared imaging for airport screening for infectious disease during SARS and H1N1 period in China, and the use of Chinese medicine during the outbreaks. She's also a board member of UCA and working with Chinese American communities in Houston and UCA members across the country to deal with this disease and its impact to the community. Without further ado, here's Dr. Zhu.
Okay. Good morning, everyone. I hope everyone is keeping safe and healthy. So first of all, I'd like to start with a disclaimer that is required that the views presented in this presentation does not necessarily represent the views of of my organization, which is National Association of Chronic Disease Directors. So just, I'm going to give a very brief overview about this. A lot of this is already, everybody knows, but I thought it would be nice to give an overview about this. So coronavirus is a class of about 200 viruses that was first discovered in 1960s. It's really a large family of the viruses. The reason it's called coronavirus is because it's shaped with a spike on the surface, so that looks like a crown. So that's why it's called coronavirus. It is an RNA virus, which is more, which are more prone to change. Some of the famous RNA viruses are influenza virus. As we all know that the influenza virus is notoriously easier to change. And the HIV virus is also an RNA virus, but it's because of the unique feature, it's now classified as another class. So it's not really officially an RNA virus. It's called a retrovirus, but it's also an RNA virus. So coronaviruses can cause diseases in both animals and humans. There are currently 7 kind of coronaviruses that can cause human diseases. The first on the screen, you can see the first 4 coronaviruses are the ones that cause most of the common cold, as we know. And then there are 3 relatively new, newly discovered coronaviruses that can cause more severe human diseases. That include the SARS virus, the MERS virus, and now the SARS coronavirus 2, which is causing COVID-19. Next slide. Okay, so this is a 3D depiction of the coronavirus. It's a single strain RNA virus in the middle. That's the genetic material, and then there is the most important structure. I'm not going to go into details about this one. The important structure are the spikes. These are the ones that can find the cells and bind to the cells and cause and then enter the cells and cause the disease. There's a little nice video at the bottom of this. If you later on, I don't know whether you send this to people, but there's a nice video that shows how coronavirus actually enter the cells and replicate and cause the disease. Next slide. So these are some data from China. They had that's where the coronavirus outbreak, the new coronavirus outbreak started. And I just want to highlight some of the symptoms of the COVID-19 disease. About 88% of the people have fever. Now, I want to clarify that in the beginning, when the disease actually started, it is reported that about half of them only about half of them have fever. But during the course of the disease, 88% of the people who have fever. So many people actually started with no fever. Okay, that's very important to know. And then cough, fatigue are the prominent symptoms. These symptoms are very similar to the flu. Next. There are some symptoms that are different from the flu. That we all know that with flu, the sore throat is a prominent feature, and also a headache. Whereas in COVID-19, these symptoms are less frequently. Another thing I want to point out that very, very few people with COVID-19 have runny nose. So if the patient has runny nose, that the chance that the patient have COVID-19 is very low. Next slide. So just want to give you a current situation. This is actually this morning's situation in the world. 1.3 million cases now. The total number of deaths has reached 70,000, more than 70,000. In the United States, there are 337,000 cases now, and 9,654 deaths right now at this point. Next slide. This slide shows the states that have been hit the hardest. New York, New Jersey, and Michigan, those states, California, those states are being hit the hardest. And you can see at toward the bottom of the screen, that's where North Carolina is. Next slide. So just some little slide about the slide. The slide got a little bit messed up, but just to show you the case fatality rate, the United States is at this point it's a little difficult. Worldwide is about 5.5, and U.S. It's about well, it's hard to see, about 2 point something out there. Okay, so this is about the case fatality rate situation. Next slide. So it's also well known that the case fatality rate increases with age. So the red line is a China situation. People complain that the situation in China may not be accurate. So I superimposed the data from South Korea, and which basically show the same. The disease actually increased with age. So the older people are more likely to be affected. Next slide. The people with chronic conditions, for example, CVD, diabetes, and there is one category as respiratory infectious disease. I clarified that they're saying that's actually chronic respiratory diseases. These people are more likely to have disease. Hypertension and cancer. People with hypertension and cancer are also more likely to have severe consequences, death. But hypertension, it is suspected that hypertension, the reason that people with hypertension has higher risk of death is maybe related to hypertension can cause CVD, and cancer is mainly because people are under cancer treatment, have weakened immune system. Therefore, they are more likely to have severe disease and death. Next slide. So for just very quickly about treatment, not going into details, treatment is largely supportive ventilation, the co-infections with bacteria and fungus, and also corticosteroids. There's a lot of discussion about corticosteroids, but the main message is we have to use that very, very carefully. And then the off-the-shelf and repurposed agent, we know that chloroquine is and the related drugs are receiving a lot of attention because of the political debate, and some other off-the-shelf and repurposed agent. And then there are also experimental medications being used for treatment. Next slide. Vaccines, this is the ultimate solution, but there are currently dozens of vaccines under development. There are mainly 4 types. Unfortunately, the vaccines are at least a year away, even though they are really trying very hard to speed up and to try to get a vaccine ready. At this point, the vaccines are still at least 1 year away. Next slide. So I'm going to talk a little bit about the what is actually the risk. So this slide shows that the people with the infection, actually, most people think in the public think that if you get the infection, then you get very severe disease. But that's actually not the case. So this slide shows that less than half of the people with the infection actually have some symptoms. Next slide. And okay, this slide again, it's messed up. So if you get in contact someone with the virus infection, what is the risk of actually having the getting infected? So this slide just shows some results that just came out in Ningbo, China. It's about 2 weeks ago. It showed that if you have contact with someone, and the risk is actually not everyone would get infected. The overall risk is about 5%, and total the risk actually differs between different contexts. Obviously, family members have the highest risk, and if you have just general contact, the risk is about 0.7%, less than 1%. Next slide. So this slide basically shows the similar thing, but in a very extreme situation with the Diamond Prince among the Diamond Prince passengers, because that's very extreme situation. But even in that situation, the people who are exposed, the overall infection rate is about 17%. The people of those infected, actually half of them have symptoms. The overall symptomatic infection is about 8%. Next slide. So I did some work and trying to estimate what is the different kind of risk after you have exposed. What is the chance of getting different things? Well, if you are exposed to people, there is about 5% of risk of you actually you have symptomatic disease after you exposed. Then about 15% of them actually have severe disease, okay, of those symptomatic disease, about 15%. So if you are exposed, then your overall risk of getting severe disease is 0.75%. And then about 5% of those with disease actually have more like grave illness. For example, you need to have ICU intervention, that kind of thing. So the overall risk after exposure is 0.25%. And then the death rate is about 2% of them will die. This is the current situation in the US, about 2% of them will die. So the overall risk after exposure, overall risk of death after exposure is actually about 1 in 1,000, less than 0.1% is 1 in 1,000. So this slide is intended to show that there is really no need to panic, even though we have to be very careful to prevent infection. There's no reason to panic. Next slide. So we have all seen this, this flatten the curve. But what does it really mean? Next slide. So this diagram just shows that on the left, if you really do nothing, then the problem is that there's going to be a big, very quick peak, and the problem with that is that it's going to exceed the healthcare capacity. So the people who need mechanical ventilation will not have the machines to provide them the proper care. And then if you do social distancing and do other things, that's going to flatten the curve on the right, which hopefully will not exceed the healthcare capacity, and people who need the care will receive the care. That will reduce the mortality and all kinds of things. So it's very important to try to do everything to flatten the curve. Next slide. So this diagram is also on Wikipedia. It shows that it's very important to try to do everything to stop the transmission, so as to reduce the transmission and flatten the curve. So if you don't do anything, then the transmission occurs very quickly. It's going to overwhelm all of the systems. However, if you try to stop the transmission, and some of the transmission are stopped, then the epidemic will be greatly reduced. And so this is a very nice diagram to show that. Next slide. So this slide shows some actual data during the 1918 and 19 pandemic. This is a flu pandemic. Looks like this pandemic is looking very, very similar to the 1918 and 19 pandemic. There are two cities. One is Philadelphia. They had the first case reported on around the 14th of September. They did not do anything, and they just until about the end of the month. And then there is a big peak in Philadelphia. That's a solid line. Whereas in St. Louis, the first case was reported around at the end of September. And then they took the measures relatively quickly, and you show that the peak is much flatter. It shows that the effect of the social distancing and the intervention, early intervention, is really important. Next slide. So what can I do to flatten the curve? These are basically taken from CDC website. The most important thing I want to stress again is hand hygiene, very important. And then cough, sneeze etiquette, and don't touch your mouth, nose, and eyes with dirty hands. Social distancing, I already talked about that. And clean the frequently touched surface very often. And then just a little bit about face mask. CDC just recommended that the general public should wear face masks in crowded places. And I want to stress the importance of the last point, which is the face mask should be worn with other measures, social distancing. Many people say, oh, if I wear the face mask, then I don't have any risk anymore. No, that's not true. If you do that, it's going to really cause the increased risk of infection. So face masks should be really used in combination with other measures. Next slide. So this is actually my last slide I wanted to talk about. So there's a very nice animated illustration on COVID-19. This is done by Yale University on the website. Now, I don't have any connection with Yale, but I just thought this is very nice. If you have time to check this out. It's basically everything you want to know about the COVID-19, about how the virus works, the social distancing, and all of those things. I think that's my last slide about some useful resources. These are some useful resources, especially CDC, WHO, Lancet, New England Journal of Medicine, Johns Hopkins. All of these sites have good and trustworthy data and resources. That's the end of my presentation.
Thank you so much, Dr. Zhu, and for your diligence. You even went to update your slides this morning and sent your updated slides by 10:30. We can tell that you're a researcher. I personally, I really appreciate your cultural perspective too, and you cited the data from Japan, Korea, China, as well as historical perspective in the 1918 flu pandemic, how important it is that we have to do social distancing. And you're right, the CDC just came out this morning that actually they recommend to just wear a cloth covering for your face. But I think that as a healthcare worker, so I think that we cannot emphasize enough about hand hygiene. Just a very brief example that I attended a webinar Saturday evening. One of the panelists was the first physician from Wuhan who contracted COVID-19, and also another physician from Seattle who is working the front line treating the patient with COVID-19. And the Seattle doctor made a comment that his colleague that day, actually two of them were tested positive, so he has to cover their shifts. One of the things that he did mention is that his hands were so worn and skin almost broken out because he washes his hands so often. But his colleague will be eating the snacks and put on the computer and that. But he was very, very compassionate and said that it wasn't the time to like a finger pointing, of course, but he just wanted to emphasize the importance of hand hygiene. Thank you so much, Dr. Zhu. And so next is our speaker, Dr. Paul Lee, and who has been also another researcher himself, and he's the go-to person for our community. So he has helped tremendously on his own time to help our community members. And thank you so much, Paul. And please present your slide.
Since Dr. Zhu has provided extensive information, I'm going to just go through my slides very quickly. Indeed, it's a global pandemic. As you see, over almost 1.2 million cases. I think today is higher than that. There are over 60,000 deaths, and fatality rate is pretty high, 5.4 globally. And in different countries, the fatality rate is different. I think the main reason is the stress of the healthcare system. If the healthcare system is under tremendous stress, you're going to have higher fatality rate. In the US, the slowing down, we have not seen the slowing down. Hopefully next week we'll see some sign of, this week we're going to see some sign of the peaking. It's very interesting, this disease, this virus is very contagious and is deadly. So we need to take it seriously. This is a case study of Diamond Princess cruise, and their total passenger and crew about 3,711. Although there are a lot of asymptomatic patients at testing, there are 46% asymptomatic, but then some of them will develop symptoms, and eventually the asymptomatic is about 17.9%. There's still 5.2% of patients require ICU, and death rate is 1.3%. So this is a good case that shows if we don't control COVID-19, in the US, COVID-19 could infect up to 65 million people, and there will be 845,000 deaths. So that's very important. We need to take this seriously, and social distancing is the way to control the spread. This is another case study. There are a lot of statistics showing that the younger people are less susceptible. But if you look at New York State study, this is an earlier study, the death rate was lower, 1.23. Now we know that the death rate fatality has increased, but you can see that below age 44 represents almost 50% of the total infected patients. So this is a disease that it affects everyone, not just the elderly and the sick. This is more recent New York State data. It's very deadly disease. You see 14% of infected patients are hospitalized, And the fatality rate, this as of April 4, is 3.1%. So I just want to summarize by saying this really serious. I know by this point, a lot of us has realized this is serious. This is not just a flu. But on the other hand, we can beat the virus if we practice social distancing. And there are evidence that Spain and Italy has gone through the worst, and the situation is improving. China, Korea pretty much has the disease under control. So if we follow science, practice social distancing, we can overcome the disease. Thank you. That's all my presentation.
Okay, thanks, Paul. Can I ask you a question, since you're talking about the importance, the point number 2, I really like to elaborate a little bit more. Yes, we can beat this virus. So one of the examples I have heard is that that the healthcare workers in Wuhan, most or if not all of them were infected during the month of January or early February when they were trying to figure out this virus. But since they started to reinforce the isolation procedure, and then from other parts of the country, they sent about 40 to 50,000 people to Wuhan, and none of the healthcare workers were infected once they started to realize the importance and also follow the procedure. Is that correct?
Yes, there are 42,600 volunteer medical professionals from other provinces going to the province of Hubei. None of them was infected because of sufficient PPE. I think that's very important. Also, the procedure is very meticulous procedure to practice, making sure that they are free of virus.
Okay, thank you so much, Paul. So now the title of this webinar is Facts, Not Fear. So we have heard a lot of facts, probably more than you care about. Sometimes it is overwhelming. And one of the things that I have done is to stay away from social media. However, we have to face the fact. So our next speaker is going to address the fear issue. And then we're very honored to have Dr. Chen to be on the panels. And please share your thoughts, Dr. Chen.
Great. Good morning, everyone. Thank you so much for having me. So thank you also to the 2 prior panelists. I thought I learned quite a lot from you all, and always do when I speak with you. So as mentioned, I'm a psychiatrist, and I'll be approaching this topic from a little different angle. And if you can indulge me for a minute, if everyone wouldn't mind just taking a big breath in and out, because as Lily says, this is a lot. So just kind of center ourselves as we try to take care of ourselves. All right, so hopefully you can see my screen. I think the word that everyone keeps saying over and over about this pandemic is unprecedented. And it's true, we just haven't seen anything like this in our lifetimes. There was the 1918 Spanish flu, but this obviously is new to almost all of us. This is a picture of Times Square in New York and a store basically out of food. And so we're sort of seeing this second wave of the virus, the first obviously being infection, the second being sort of mental health related. And I really wanted to focus this talk specifically on you, the nurses, because you all are on the front lines. So of course there's mental health effects for everyone. People are at home, social distancing, it's feeling very isolated. There's also specifically increased attacks on Asians and Asian Americans affecting their mental health. But today I'm going to focus on you, the frontline nurses, and how do we promote our own mental health. So here's a study that actually was published just 2 weeks ago in a JAMA Open journal. Taken from China, where they actually looked at mental health outcomes among healthcare workers who were exposed to COVID-19. They used a sample of over 1,200, as you can see here, taken from 34 hospitals throughout China, and larger representation of nurses than physicians. What they found was, using sort of scales to measure symptoms of various psychiatric illnesses, obviously much elevated rates of concerning symptoms, 50% depression, 45% with anxiety, a lot of insomnia, and certainly the majority had some level of general distress. They also noted that those who were engaged in the direct diagnosis, treatment, and care of patients with COVID-19, so not just that they were potentially exposed in the hospital, but that they were actually caring for these patients, were more likely than those who did not directly care for those patients to report all of these symptoms. So clearly there's, again, this sort of secondary mental health impact of this illness. So as mentioned, the word that we keep hearing is unprecedented. I'm sure all of you are feeling this way. I certainly feel this way. In my day job as medical director of outpatient psychiatry services at MGH, just sort of having a very hard time wrapping my brain around how do we do our work. It's like trying to solve a puzzle when all the puzzle pieces keep changing. And so here we are trying to do the best we can and remain steady, and yet seemingly every day or every hour, even there's a change in policy. And so I think that's one of the mental health challenges in the current moment, is much like this lighthouse, trying to stay present and grounded to help others, while also making sense of and adapting to constant change. A lot of the information I'm going to be sharing with you is taken from the National Center for PTSD, which is a fantastic resource that I will put the link to at the end and share with you in the slides. But they were describing that there are certain COVID-specific stresses that frontline healthcare workers face. The first one meaning biosecurity. So you all are being called upon to treat those with COVID-19 and often experience signs of physical strain just from wearing all this protective equipment, dehydration, heat, and exhaustion. There's physical isolation. Obviously, you can't touch others or be around others. You're constantly aware of and vigilant about infection control. All of these things are leading to a mental toll. Next, of course, the contagion thing mixes with the first, but there's this incredible risk of disease transmission. And so just worry about transmitting this to others, higher mortality rate compared to influenza. And there's a tension between public health priorities and the wishes of patients and their families regarding quarantine. So often you all are the ones negotiating those difficult conversations. Of course, all of us don't exist in the vacuum. We're not just there to provide care. We have many competing personal and professional demands. And often the complexity of responding to this causes direct conflict of these, trying to continue with our daily workload that already existed pre-COVID, and now there's the COVID measures, and then coming home to your family and not wanting to contaminate them. And then, of course, stigma. I think infectious disease is ripe for stigma. You know, it's something that can be caught. And so we're already seeing stigma applied to certain populations that are viewed as more infectious or sort of being blamed for this illness. And also I think healthcare workers now experience our own degree of stigma if we're going into the hospital. So there's both external stigma from others and then our own internalized stigma, as well as I think crucially stigma that's longstanding that prevents us from seeking help if we need it. And that's one of the things I'd like to address today. So these are all, again, from the National Center for PTSD, normal reactions to COVID. Many of you may have experienced these feelings yourself in the past weeks, including helplessness, a loss of control, feeling exhausted, guilt about fearing the illness, not having enough resources, not being able to do as much as any of us wants to do. Some people are feeling sort of an empathy burnout, feeling numb, and then feeling guilty about that. There's obviously tons and tons of anxiety. That's probably number one, just with so much unknown. Anxiety about one's own health and well-being, other people's. Also, I think anxiety and suspicion about the systems that we are working in. It can be very demoralizing to feel that folks don't necessarily know what they're doing or that rules are changing, which then can lead to anger, perception that others' actions are putting yourself or others in harm's way, or blame. And then finally, of course, grief and depression about the lives lost, about health, about your own health, your family's health, time, income, and resources that have been lost, plans that you have made, everything being upended. And just to underscore that last point, I don't know, some of you may have seen this Harvard Business Review article that was shared widely on social media a couple weeks ago, where it was an interview by Scott Bernardo, but of David Kessler, who had worked very closely with Elizabeth Kubler-Ross. She's a very famous psychiatrist who had developed the models of stages of mourning and grief. during bereavement. And he was pointing out that a lot of what we are feeling, even if we can't name it as such, is just grief about things changing. And here's a quote from the interview. "We feel the world has changed, and it has. We know this is temporary, but it doesn't feel that way, and we realize things will be different." So in this terrific talk that I've also included at the end in the resources by Patricia Watson from the National Center for PTSD, she gave a talk for the Schwartz Center for Compassionate Healthcare, and I'm borrowing a lot of her framework because I find it very helpful. So she talks about how we as healthcare workers often are driven largely by our values and ideals, and that we tend to see the strengths of those values and ideals, but they often also have sort of a double-edged side to them, what the psychoanalyst Carl Jung would call the shadow side. So the idea that anything that's positive may also, in excess, cause a problem. And so I just want to share that with you because I think it impacts how we react to this illness. So many of us in helping professions are driven by this ideal of selflessness, this idea that we would place others ahead of ourselves. The shadow side of that, of course, is that we often don't seek help ourselves. And, you know, you can raise your hands. Probably nurses are better at this than doctors, but if you ask a room full of doctors, you know, when's the last time they actually went to their own routine physical exam or the dentist and things like that, we tend to not take as good care of ourselves. We tend to sort of be focused more on helping others. Similarly for loyalty, which drives many of us as well in our teams, it's driven by a sense of protecting others and sort of being part of a group. But the shadow side may be guilt and inability to move on if something happens that's negative. It can go on and on. Many of us prize stoicism, sort of complaining, enduring without any complaint. The shadow side being that we may often be unaware or just not willing to acknowledge our own symptoms and suffering. Being driven by a strong moral code, of course, is great for giving us a sense of purpose, but we can also often feel frustrated and betrayed by others' actions. And so I'll just click through here, but you can see that each one of these things that drives us in our normal day-to-day life, when taken to an extreme, which I will argue often this type of experience will drive us to, may pose a problem. And so I think it's very important for all of us to recognize and honor that there is a natural balance that does exist. Obviously, our ability to provide self-care and support is inversely proportional to time and resources. So when we have lots of time and resources, or maybe put a different way, the ability to do this is directly proportional. But I think that as time and resources go down, obviously self-care and support are the first ones to go out the window. As helpers, we all want to keep helping, but obviously I also strongly believe in the idea of sustainability, which requires us to recognize our own limits and seek help when needed, and all the more important right now during this period. So thinking through this, many of you, especially the psych nurses in the audience, may be aware of what's called the cognitive behavioral triangle, or the cognitive triangle. It's the idea that our mental lives are comprised of thoughts, feelings, and behaviors, and that these things are all linked, that each one affects the other. And classically, when we teach patients about CBT, we explain that of these three things, the one thing that you can't really just change on a dime is feelings. It's like the weather, and that's what I tell patients. You know, many patients are frustrated that they're feeling anxious or angry. And you sort of say to them, you know, it's just as good feeling upset about that as it would be about being upset that you're sweating when the temperature is high, when it's hot outside. It's just your body or your brain's way of giving you information about how it's responding. So while we cannot change feelings in the moment, we can change thoughts and behaviors. And so the feelings many of us are experiencing, I went through before, anxiety, guilt, anger, grief, etc. Those are normal and natural, and they are understandable responses. But there are a number of things that we could think about when we think about how do we actually move from a place of just feeling helpless into one where we have a little more control and agency. And there are also self-defeating obstacles that can get in the way. So when you think about thoughts, there's a lot of unhelpful thoughts that might arise during situations like this. And again, for helpers, often those thoughts take the form of, it would be selfish to take a break from work, or others are working hard, so should I. I'm okay, I'm fine, I'm not even tired. Only I can do X, Y, or Z. The needs of those I'm helping are more important than my own, etc. And when Dr. Watson gives this talk, she actually says that she's surveyed survivors of disasters, first responders, EMS, military, etc. And she always asks them, like, what would you tell other people who are in the midst of a disaster setting? And they say, please tell people they need to take care of themselves. The adrenaline kicks in and they think they're fine, but then it goes away. And then they realize they're actually exhausted. So they have to take care of themselves. And then people follow up and say, well, does that work? And she says, actually, no, because people who are set up this way don't listen to that. So really part of what we need to be doing is telling each other to take care of ourselves. It may be easier for you to say that to your colleague rather than to hear it yourself. The other thing is to think about your own behaviors that may actually be obstacles to diminishing these negative feelings. So things like working too long by yourself without checking in with others, keeping all your stresses to yourself, and then of course relying on sort of less adaptive behaviors like use of alcohol, substances, to relax for extended periods of time. Of course, there may be a time interval for those types of things, but if we over rely on them, basically these thoughts and behaviors are just reinforcing the negative feeling. So we need to kind of start to shift this cognitive triangle to become less helpless and overwhelmed. This is another resource that was shared in this document that I found very, very helpful. Basically thinking about all of us as being on some spectrum of this. And in this webinar, they've called it stress, but actually another word that we may be familiar with is trauma. I think all of us are going through a form of trauma in addressing this pandemic and being on the front lines of it. And all of us are going to probably dip into various regions of the yellow, red, or orange, or even red zones here. So I think what I like about this is really connecting sort of things that you may see in yourself or others to varying levels of function. And what they're saying is, many of us, when things are on normal period, we're in the green zone and we're doing well. We're all working together as a team or a unit. But as stresses rise, it's perfectly normal for certain people to develop some of these features. We could call them symptoms, but they're just evidence of stress sort of overwhelming folks. And you can see that the middle tiers are sort of the responsibility of all of us, both as individual providers, but also as peers and family, to recognize these signs in others and then help them out. And then on the far right is the red. That's where this probably needs to be referred to someone professional for treatment. So I'm going to move along here quickly. Again, these slides will be shared, but on the individual level, these are things all of us can do to kind of try to make sure that we're being optimally caring for ourselves. And then a number of don'ts. Summarized by this image that some of you may have seen on social media. Are you in the fear zone, in the learning zone, or in the growth zone? And initially, of course, many of us were in the fear zone about, do I have enough for me and my family? But you can see if you sort of live in that zone, it kind of self-perpetuates. So we want to move to these to the right. Just a quick word, Dr. Watson in her talk really emphasizes the power of peer supports. Not everyone needs to go see a psychiatrist or therapist, or even can, but I think there's a ton of ability to help each other. So this psychological or stress first aid was developed by the National Center for PTSD for high-risk occupations like EMS, military, et cetera. And they've found it's evidence-based, and that early management of these reactions can help prevent progression to PTSD. Acute stress disorder is sort of the definition of a PTSD-like response that occurs much earlier in the weeks to months range, whereas PTSD usually is many months later. So what we want to do is, again, flatten this curve and prevent some of these cases from progressing. So what can peers actually do? And this is a very important slide. If you don't remember anything else, Dr. Watson also says this is what she wants you to remember, which is that it's really basic. It almost goes back to Maslow's hierarchy of needs. So providing a sense of safety, helping someone to recognize that they are safe. This is crucial for all of us. That's like the lowest level of the Maslow's hierarchy. So the next one is calm. You obviously helping someone to calm down. Next is connection, social supports. And for the introverts out there, she emphasizes that you don't necessarily have to talk to 100 people. It could be that you have 2 or 3 people that you check in with And you have to be intentional about it, because in this day and age, it's very hard now to just sort of hang out with someone at the water cooler. You got to like build it into your schedule to check in, because that's part of self-care. Developing a sense of self-efficacy, which is a belief in your own ability or capacity to, or resources or supports to get through a difficult situation. And then finally, hope. And all of these feed each other. So what Dr. Watson says is you don't need to, each person their needs will be different. And so you can sort of tailor which of these you're going to pull out and sort of talk to the person, try to understand where they're at. If you notice something is, they're struggling, you can just observe it as their colleague, as their friend, and say, you know, this is what I've noticed. I'm wondering if this might be helpful. So just to offer that. I just also wanted to make a note. There's a lot of literature that during acute stressors and disasters, it's not helpful to extensively psychologically debrief. There was a belief in the past that if you just sort of talked all the way through everything terrible that was happening, that would help the person sort of get it out of their system and move on. And actually that's contraindicated. That actually has been proven to increase the rates of PTSD. So the goal of this type of approach is not to extensively debrief with someone about whatever happened on their shift. It's more to notice distress and then provide these sort of very basic interventions or offer of help. Finally, I'm going to end, this is my last slide, with resources. You know, certainly in your own hospital's employee assistance program, if you're struggling or see someone else who is, please refer them here. I included the National Center for PTSD, which is a text-based resource. The Schwartz Center has the webinar that Dr. Schwartz gave, which you can view for free. And then finally, our hospital's Department of Psychiatry has put up sort of a living guide, which includes a section for healthcare providers specifically. So if you or anyone you know is struggling, please don't hesitate to reach out. Again, and I want to end just like Lily by saying thank you so much for all of the work you're doing. You know, in psychiatry, we've moved entirely to telehealth, and we're able to do that, but I'm very aware that nurses are on the front lines doing this work every day, so thank you so much.
Our last panelist, Dr. Helen Shih, she's one of those persons that has done a lot of community work as well as a former researcher in healthcare.
So Libby and I, Paul and Justin, we all work with an organization called United Chinese Americans. We're the one which actually started to work with the COVID relief ever since this is happening in Wuhan and also in China. We actually formed a national platforms and local task groups to deal with many aspects of COVID relief, from medical supplies to public health prevention. We're trying to bring knowledge and experiences and expertise from China to support our doctors and hospitals, healthcare system here. We also have a team specifically addressing the racism and a rise of hate crime and social political impact, as well as vulnerable community. And our message is about Save America. So I want to let you know that our healthcare workers and professionals are supported by every single community and organizations you can think of. We're trying our best to try to bring the do here. I work with UCA on the project of public education series. That's the one we're trying to crystallize the most important and precious experiences and expertise from China and bring that over here to help to educate the general public and the community of what they can do in prevention and as well as community education. I want to skip 2 slides, which previous panelists have talked about. And the question we really need to address at this point is really who becomes severely ill. Because if you think about that, if one just maintain asymptomatic and mild symptoms, which actually happen to majority of the cases, then we'll be able to go through this storm in an easy way. The problem is if we will overwhelm the medical system and people end up to be in ICU, this is how our healthcare system collapsing. So that is really the key that we have to address at this point. And we know that at this point, age is a big factor. This is a study just by Lancet recently, and also underlying condition, which mentioned by Dr. Zhu. And this is study just come out also by CDC. So I'm really glad our doctors and researchers are keeping track of solving this mystery, that how we can achieve mild symptoms or asymptomatic if you're really lucky. So to me, coming from a very holistic point of view, there is a very intricate balance of our immunity. Because first of all, we want to strengthen our immunity so we're able to defend ourselves against virus. And secondly, those who end up in the severe symptom, we know the issue is this called a cytokine storm. That means our body overreact to this virus attack. And actually our society overall, if you think about that as a person, is actually going through this cytokine storm because our society is actually overreacting on that. So your goal is, and everyone, our goal is to keep our immunity and our health in a very optimal window and maintain that very intricate balance. I also want to say that I'm really glad that Dr. Justin Chen had mentioned extensively about mental illness and mental stress. So the key thing here is try to keep it calm and simple. Because if you think about this, the virus can only enter our body by 3 ways, the mouth, the nose, and eyes. So if you can keep those 3 things clean and clear away from the virus, that's all you need. And let everyone else in your family know about these 3 things, the mouth, nose, and eyes. So beyond those, you don't have to worry about anything else. We also want to be very mindful of the mental effect and keep in mind about this word called mind over matter, because right now we're also going through the information overload. If you look at the amount of media we have received on a daily basis, that's just overwhelming and it causes additional stress to our mind. And Dr. Pauly reminded me about this word called infodemics. That's called a virus in our information system with so much misinformation, disinformation. That's something we have to be very mindful of. My field is holistic healing and energy work. Some of the nurses may be aware of this field called a human energy field. I have been involved in research and study about how we can use our mind and use our energy field to shield against the virus. So if you're interested, we can always talk about that more. My website, I have certain supplements and herbs that might help you. That's been translated from the Chinese experience, because Chinese medicine is being used in this pandemics to address the prevention need and also try to reduce the severity of the symptom.
Helen, can I interrupt you just for a minute?
Yeah.
So since we supposed to start the question and answer sections, and Dr. Lee and Dr. Zhu has been actively engaging the audience on the question and answer section. So type in your questions and they will answer as soon as they can. Go ahead, Helen. You can, for a few more minutes.
I'm trying to end my talk.
Oh, okay. Sorry.
So maybe what we can do is to send a slide and then to the nurses, because I did create a survey for our first line defenders and also the nurses and healthcare workers during the initial Wuhan outbreak, because they were in the same situation as what we are now, a lack of PPE and severe stress and overwhelm of the our healthcare system. Let me see if my key steps summarized somewhere. So there are a few things that we really want to do to address the our mental emotional health. That's something that we have to be very mindful of. So I want to summarize, those are some of the keys we have found out. Number 1 is really protect your rest and your sleep. So even if you don't have enough hours sleep, make sure you take naps during the day. I feel like I'm preaching to the choir because the nurses probably all know and develop their own system of maintaining their health and nutrition protection for your body and de-stress. Those are critical things that we have mentioned about. And also mental, emotional, and social support, that's really key. And again, as I said, keep it really simple and set a goal and make that as a second nature and become a daily ritual. That's something that you can go through this. So there are certain practical things you can do, such as how you can set up a boundary in your house to minimize the virus load come into the house and how you can minimize contamination, what you bring from your workplace, because every nurse is thinking about how they can protect their family. Again, these materials can be shared with all of you after the talk. I have set up a Facebook page as well as on my website to create this challenge and goal called 60 Days in Optimal Health. So essentially what this virus is asking you to do is to keep, again, the image I have shown you earlier with this intricate balance of your health. So keep your health, which means strengthen your immunity so you can defend the virus, but not overreacting, because when you're stressed and overreacting, you're creating a cytokine storm in our body and also in our society. So the matter is within the next 60 days, we need to create our optimal window of health and immunity and to go through this storm. And the last but the least, I want to remind everyone that this is really an opportunity for ourselves, because none of us is going to have this kind of opportunity or crisis. This is probably one in a lifetime we're going through. So it's important that we recognize that from a spiritual perspective, our soul truly loves crises and challenges, because this is how we grow. So I want to use this slide to end this talk because this is truly our lifetime story, that how we go through this crisis, to create a narrative of how you want to leave a story behind, and how we can set an intention to align our thoughts, actions, and choices, emotions, and our complete community to work together, and also communicate this story with other people and build a good supportive structure. And the one last piece is always keep a positive, brighter outlook, and faith is so important through this process. So thank you so much, and I'll be happy to answer any questions.
Thank you so much, Dr. Shih. Again, apologize for the time crunch, and you have done so much work and research on this area. We really enjoyed those thoughts that you just presented. Keep a positive outlook. That being said, we have about 9 minutes for question and answer. So, Kamel, would you just let us know, or just audience have any questions, and you can ask, and any of our panelists can answer. And also all the slides, all the panels that prove that you can use their slides. Thank you so much for your generosity and time. Again, all the panelists, you did a great job.
Yeah, we will. This is Camille with NCNA. We will be sharing the slide deck with everybody, so you will have access to that. I do see that some of the questions have been answered via the chat option, but some of the questions that just came in, it says, I work primarily in long-term care, which is a different kind of frontline. What about resources for these facilities and staff? Do any of the panelists want to answer that?
You know, I can maybe speak a little bit from my personal experience. I know that like, again, I am a volunteer for our organization for United Chinese American. We have organized a lot of relief efforts, donating PPEs on a national level and from different local facilities. So my understanding is right. So you're talking about the resource in terms of PPEs availability, right? So so I think it really depends on, I don't know about on the policy level or the government level, but I know that the focus has been on the hospitals, and then personally I have collected supplies from friends and donated to assisted living facility in RTP area, and then also in Chicago, like the clinics, free clinics and Martha's clinic, and they're serving low income, so they don't have as a well stock supplies. So they're depending on friends in informal channels. Anyone else have answer to that? Helen, is that your impression too in terms of supplies?
Yeah, so actually for the long-term care, I agree it's definitely a different set of challenges. So the good thing is we're not going to hit that the peak, right? So to me, everyone is working very hard to provide the PPEs. So I hope the government will step up, right, at the federal and state level and coordinate it better. This is so critical. And I would ask people to really invoke their community support, because there are people hoarding on PPEs, and I hope that they will release it. And when they see that our healthcare workers, frontline workers really need this most. So I would definitely suggest you to, go out to reach out to the community, and something can bring it over. And the other thing is the long-term care also is long-term stress. So I would definitely re-emphasize the importance of mental emotional health, and again solicit the community and family support in helping sharing the housework, the workload, and from coworkers. All of these are so important. So we don't want to create really long-term stress, and now we're going to reap the results if we do that. So that's very critical.
Okay.
Helen, while you're talking, someone was wondering about your Facebook page again. Do you mind sharing that in the Q&A section? You have developed a Facebook page, right?
How do I share this?
Okay. As you look, okay. Sorry. As you look, go ahead. Sorry.
We're gonna send out the slides, right? So if you can email the slides, I think it would be able to good.
Okay. Yeah, we can include the link to the Facebook in the slides that we share. Absolutely.
Yeah.
All right.
So I'm not sure if everyone can see the question and answer that is posted on the section. So I don't know if anybody has a question would like to ask. Otherwise, we can read off a few questions from that box and then have the panelists answer.
Yeah, here's a question that I think that we could have maybe some of the panelists elaborate on. The question is, how easily are antibodies detected? How much do they protect against reinfection, and how long do they persist?
I have answered that question in the box.
Yeah, I didn't know if you wanted to elaborate on that a little bit.
So I just want to start. There have been tests developed to detect the antibodies. How long does it last, and how protective the antibodies will be is still being actively researched.
Okay, so perhaps there's one more question I thought may be relevant to nurses. Is what about patients who have not had respiratory symptoms and mostly body aches and nausea, fever, and fatigue? Are you seeing this type of patients, or can we test for antibodies for those to determine if they have had, which would tell us that COVID-19 prior to March, as we know that the symptoms vary patient to patient? Paul, Dr. Lee, maybe, and Dr. Zhu, perhaps you can answer.
Maybe Dr. Lee has left.
Yes, he left at 12.
Okay, I see. Okay, so he did answer here is FDA approved an antibody test recently. Hopefully it will become available soon. So that's the answer.
Yeah, that's actually the one used in China now. So if you're aware of that, the Chinese medical and prevention guidelines have gone through 7 iterations, and about testing antibody is actually included as together with the PCR to confirm the case. And antibody also have the advantage of responding much faster and much easier to do than PCR. So I hope in the US we're going to have that in a much more prevalent way very soon.
Okay. I think I have time for 1 or 2 more questions. Here's one. Can people become infected a second time?
I'll give a shot. I'll give it a brief shot. I don't think anybody knows that yet. Based on the past examples, for the MERS, there's very little evidence, and also SARS, very little evidence that they can be reinfected. But for the new virus, I don't think anybody knows the answer yet.
Okay.
Thank you, Dr.
Some of the Chinese doctors are tracking this because they are the first ones who studied this, right? And they have a much longer time lag now. They haven't seen a lot of mutation yet, so they suspect this antibody will probably function a while, but long term we don't know yet because that requires long-term study.
Thank you so much for both of your answers. And again, we want to thank you, Dr. Zhu, again, for sort of, you know, the last but not the least, filling in for Dr. Weber, who has been also very supportive of our public education, but he just have 2 back-to-back COVID-19 meetings today, so that he could not be with us, but still we want to appreciate his previous involvement and compassion to educate the public as well as the nurses. Camille, do we have questions for one more questions, or are we done?
Yeah, let's do one more question. How to clean N95 masks that they have to reuse?
So let me take the first shot. So there have been technologies developed, especially Patel has developed the technology to mass disinfect the N95 respirators. So I don't know how available that those machines, big machines, are in different states. There have also been some other method developed, like for individual use, using heat and those kind of things. If push comes to shove, you can try those things, but they have not been really studied to be whether they will be that effective.
So regarding the mask, so there are several ways. UV light is one of them. Of course, not very commonly available at home. Baking, right? People put the mask, you see all of this on the YouTube. The other one is alcohol and hydrogen peroxide. Those people have tried. There are studies coming out about putting those masks in hydrogen peroxide vapor, but that's by a sort of large scale. But I suspected that we have to do something creative and just make sure the mask is still intact. The problem of personal disinfectant to me is in case the structural have damaged, then they may have the air leak through those gaps. That's something we really have to be careful.
Just one word about alcohol. It's dangerous to actually use alcohol to clean it, because alcohol actually dissolves the filtration system. So it actually makes it more likely to leak. So alcohol is, don't use alcohol.
Yeah, okay, thank you.
Well, I think that we're kind of running out of time here. So I just want to thank everybody for all of our speakers and all of the attendees that listened in. We hope you got some valuable information out of this. Just to recap, 1.25 contact hours we offer to NCNA members. So check your email in the next day or so for an email with the evaluation link to obtain your CE. A recording of the webinar will be posted on the NCNA website for anyone to view. CE is not offered for the recorded version. And we do have quite a few upcoming webinars. The next one is April 14th. And so I invite you to check out the NCNA website to save the date for all of those, because we've got some really good content coming up. And if you have any questions or comments, you can email us at the email listed here on this slide. But otherwise, I think we are all done, and I thank everybody for your time today.
Thank you, everyone.